Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. What a strange and just a bizarre summer we've all had. I don't know about you, but I'm putting on the COVID-19. I will say that there's been an awful lot of activity. Working from home is bizarre but productive. So let me get started right away. The first is that the companion bill in the Senate has been introduced to the Medicare O&P Patient-Centered Care Act. The bill is 5262 in the House, and now the number in the Senate is S4503. 4503 is introduced by Senator Daines, a Republican from Montana, and Senator Warner, a Democrat from Virginia, as well as a number of other senators who have signed on, including Senators Cornyn from Texas, Senator Cassidy from Louisiana, Senator Duckworth from Illinois. It's a bipartisan bill. It does the exact same thing that the House bill does. Four main pieces. It separates DME from orthotic and prosthetic clinical services. It reforms the definition of off-the-shelf orthotics to restore congressional intent so that the definition of minimal self-adjustment really is just that, adjusted by the individual patient or beneficiary, him or herself. For purposes of competitive bidding, that is going to refine the number of orthoses that are exposed to that program, and that potentially would preserve additional access to clinical care for custom fit and or custom fabricated orthoses down the line. Next, the bill exempts orthotists and prosthetists who are certified and or licensed from competitive bidding. So yes, they would be exposed to the competitive bidding rate in the area in which they practice, but they would not need a contract with CMS in order to provide OTS orthosis. And finally, the bill would ban certain drop shipping to patients' homes of anything other than truly off-the-shelf orthoses. We feel that this is an important bill. It addresses some of the key elements of what's taking place with respect to some of the Office of Inspector General activity on orthotics. The OIG has recently issued 3 separate reports on orthotics that detail orthotic suppliers that have a business model where they predominantly ship orthoses directly to patients' homes. Unfortunately, many of these error rates are extraordinarily high, like 100%. And that obviously reflects poorly on the orthotic field generally and across the board. But more to the point, it really doesn't reflect traditional orthotic practice. And that's a point that we've been making to Congress, to CMS, to the Office of Inspector General, and will continue to make. Those reports, in some respect, bolster the need and suggest that the Congress really does need to pass the O&P Medicare Patient-Centered Care Act. Next, CMS will reinstate Medicare audits as of August 3rd, and they will proceed with their program for prior authorization for 6 prosthetic lower limb codes as of September 1st. September 1st, it'll apply in 4 different states: Texas, California, Michigan, and Pennsylvania. And then on December 1st, prior authorization for those 6 codes will apply nationwide. On September 10th, the Noridian Medicare Administrative Contractor will host a webinar with additional information for providers and suppliers with respect to prior authorization. NAAOP, you must know, has very significant concerns about rolling out a new documentation process for these types of prosthetic components in the middle of a pandemic. We've worked with our alliance partners and have requested CMS to delay this program until the first of the new year. We continue to work with them to see if we can get that done, but it does look as though this program is moving forward, at least in those 4 states. We'll continue working with other stakeholder groups, including physician organizations, to alert them to this issue and try as best as possible to answer any questions that come our way. Next, we wanted to mention S4545. This is legislation that's brand new, introduced just in the last couple of weeks, the Amputee Coalition of America was successful in getting, Senator Blackburn and Senator Duckworth, Blackburn, a Republican from Tennessee, and Duckworth, a Democrat from Illinois, to issue or to introduce new legislation called the Amputee Study Act. This is an act that would essentially dig into the data and try to identify the universe of individuals with limb loss and limb deficiency. Right now, the data we rely on as a field, as a profession, is very dated, and it's time to update that and to use whatever data sources available currently to give us a much better sense for who uses orthotic and prosthetic care and the practice patterns that they have, and a lot of the demographic data that will help our field advance prosthetic and orthotic care in the future on behalf of amputees and others with physical disabilities. And finally, Nicole Verkeilen, our inaugural fellow a couple summers ago, and now our newest, one of our newest board members, is embarking on a new challenge. Nicole, through her organization, Forest Stump, has decided to run in conjunction, the announcement being in conjunction with the 30th anniversary of the Americans with Disabilities Act, has decided to run a new program. It's called hashtag We Just Felt Like Running. This is a program to highlight the need for insurance companies to cover assistive devices, technologies, prosthetics, orthotics for people with disabilities who are interested in remaining physically fit and active. Nicole and NAOP stands in solidarity in suggesting that this is discriminatory conduct on behalf of insurance companies, primarily private insurance companies, to deny access to certain types of prostheses, orthoses, and other assistive devices that will allow people with disabilities to participate in sports, activities, and other endeavors that will allow them to remain fit and active. And so Nicole's organization will be running a virtual race on October 3rd that will culminate in Washington, D.C. with the presentation of a petition to Congress to encourage them to pass legislation to ultimately improve access to care and all kinds of prostheses, orthoses, and other related assistive devices and technologies to assist people with disabilities to remain active and fit. NAOP is strongly behind her. We wish her well, and we will be participating in this initiative. Congratulations, Nicole. And with that, have a great ending of the summer, and we look forward to the next opportunity to provide a webcast and inform you of events as they occur. Thanks so much.